Back on the streets and committing more crimes. One of the first inmates out of prison under the governor's COVID-19 release program now faces several charges. KOMO's Jonathan Cho has this Operation Crime and Justice report.
Late Sunday night, authorities say 43-year-old Flaviano Basaliza took Gig Harbor police on a high-speed chase, reaching speeds of up to 92 miles per hour.
The driver lost control of his vehicle and crashed on a rock and fled from the car. Officer was able to get him into custody.
Chief Kelly Busey says Basaliza was suspected of being a prowler. His female passenger was not arrested.
The unique thing here is that after he was in custody, he admitted to methamphetamine use and that he had just recently been released from prison due to this COVID-19 situation.
The chief is talking about the governor's early prisoner release program. It's an effort to fight the spread of the coronavirus behind bars. More than 1,000 nonviolent offenders will be back on the streets. Basaliza is one of them, and one of the first to reoffend. He was doing time for stealing a car. Busey says the law enforcement community is frustrated because they warned state leaders this would eventually happen.
So who's tracking these people?
I don't know that.
The governor's office did not answer that question or comment either. Instead, pointed us to the Department of Corrections. A spokesperson sent us a statement that reads in part, "The terms of post-release community supervision are established on an individualized basis based on court orders." In Basaliza's case, he wasn't required to check in with anyone.
Due to the jail booking restrictions right now, we can't put non-violent felony offenders in jail. It's a bit frustrating right now.
And that's why even after the most recent crime, the chief says Basaliza was arrested and released again.
All across the city, closures, temporary and permanent, have taken a toll. Seattle's $1.1 billion hotel industry hit hard. Even harder hit is Seattle's $3.2 billion restaurant industry. There are 2,800 restaurants in the Emerald City.
I think people are dying to get back out to their favorite restaurant.
Restaurants face some big changes ahead.
Restaurants are probably currently redesigning their restaurants to make sure there's 6 feet between your group and the next group that comes in.
Expect changes in hotels, too.
It wouldn't surprise me if you're waiting to check in, if you see those placards on the floor to say keep a distance from your guests.
Offices and workplaces will also need to adapt to new expectations. Madrona Venture Group, a local venture capital firm, has put together a very detailed roadmap to help Seattle area businesses prepare their offices to reopen when the time is right.
It's really meant to be a toolkit. It's sort of, if we walked a mile in the average business owner's shoes, this stuff can be daunting. It's a lot of time, and so we've created a website that is an actionable toolkit.
It's called Back to Work Toolkit. Madrona Venture Group put it together with advice from 15 major companies, including Microsoft, Starbucks, and Amazon.
That toolkit has templates. It has links that are needed. It has sample policies, all kinds of stuff meant to save tons of time for the average business owner.
That toolkit is free and open to anybody.
It's all there, and it's meant for everybody's consumption.
For those of you at home who have a mom or dad, brother or sister staying at a long-term care facility, the last couple months have been trying on you and your family. You can breathe a little bit easier tonight. Now, those infected with COVID-19, they'll have a place where they can recover. That's not at the hospital, and it's not at that nursing home or long-term care facility where they could infect other residents. They're called COVID Specialty Wings. The first one is set to open in King County next week. Infected at the nursing home, ambulance to the hospital, and then back to the nursing home to recover. That cycle played out at the Life Care Center in Kirkland, where hundreds were infected and at least 30 people died. Bridget Parkhill and Carmen Gray were visiting their mom Susan, still recovering from COVID, when I told them those infected will soon have a designated space to survive. Do you think it could have made a difference?
100% would make so much difference for the patients. I think that a lot of them would have survived.
There is hope, and that's what we're all living for.
Robin Dale, president of the Washington Healthcare Association, said these COVID specialty wings at 3 state nursing homes have been in the works for weeks, but just got the green light.
If we can have COVID-specific wings or COVID-specific buildings, we hope we can stop the spread of COVID among the population that's not infected.
These wings, with 150 beds, will be isolated from the rest of the chosen nursing homes, with separate entrances and staff, even a separate ventilation system. In Ballard, 84-year-old Rachel Johnson, the mom of KOMO's Eric Johnson, is now optimistic, despite the first resident at her retirement home contracting the virus this week.
We're trying the best we can to cope with everything.
And I think that something like that will be reassuring and just make us relax a lot more.